Joining me now, Congresswoman Karen Bass of California. And Congresswoman, your colleagues across the aisle have been making a lot of the death spiral. They've quoted the Aetna CEO particularly. They keep saying that Obamacare is collapsing. What is your response to that?
Well, you know, especially coming from the state of California, which is one of the reasons why Obamacare has been successful nationwide, because California, the population is so large. I just think that that is the fear-mongering that they are using to justify what they're getting ready to do, which is potentially cut 15 million people off of health care coverage. I don't believe there's a death spiral. I don't believe that it's getting ready to collapse. That's certainly not the case in California.
I mean, you're a congressperson, and you're going to have to vote on this at some point. I mean, do you have insurance company lobbyists, for instance, coming to you saying, this is in a death spiral, it's exploding, you need to bail us out, you need to do something?
No, I don't. You know, the insurance companies have not been lobbying us. I mean, this has been a big win for the insurance companies. Requiring everybody to have insurance coverage, you know, it's definitely been a big win. You know, in California, we certainly attempted to pass a couple of ballot measures that would give our insurance commissioner more control over keeping the premiums lower, but the insurance companies put in tens of millions of dollars and defeated those initiatives. So a lot of the problems that people say are because of Obamacare, they're not necessarily because of the Affordable Care Act. It's because there's not enough control on the insurance companies themselves.
So how long have you been in Congress, Congresswoman?
I'm in my 7th year now, and I have voted over 60 times against the repeal.
So let me ask you this. You're seventh year now. Have you ever seen a piece of legislation of this magnitude and import being moved this quickly in your congressional career? No,
absolutely not. And ironically, isn't this the same thing the Republicans accused the Democrats of doing the year before I got here? You know, we are voting on this bill, and it hasn't even been scored by the CBO. Now, we're expecting the CBO score in the next couple of days, but right now we believe the CBO is going to show that about 15 million people will lose their coverage.
Do you think there is any way to stop this in the House? I mean, it is sort of remarkable to watch leadership go to work, and I've spoken to some of your Republican colleagues, obviously, to basically ram this through. What are your options in the minority there?
Well, hopefully that there will be enough Republicans that refuse to vote for it. You know, there weren't enough in committees, but listening to my colleagues that are in those committees, I heard that the Speaker himself personally had to come to the committee and twist some arms. So I don't know if they have the capacity to twist as many arms as would be needed to pass it off the floor, but we'll certainly see.
One of the arguments that your colleagues are making across the aisle, Republicans, is that Paul Ryan called this an act of mercy. I mean, his argument is the whole thing's floundering, it's imploding. What we're doing is going to be best for people, and in fact, we're doing this to look out for the least of these in biblical terms.
Yeah, and it's absolutely not the case, because it's going to be the least of these who lose coverage, especially people who come from expensive states like California, like Los Angeles or San Francisco. So older people, low income, who live in high income areas are definitely going to be the losers. And, you know, much respect for the Speaker, but this is the person who wants to, in my opinion, take Medicare and turn it into vouchers. This is going to be an extremely deep cut to Medicare, and so the consequences of this, I think, are going to be very severe. It's going to remind me back to the days when I worked in the emergency room in Los Angeles County, when people would come into the emergency room extremely ill, and that, ironically, of course, is what costs so much money when people come in ill.
All right, Congresswoman Karen Bass, thank you.
Thanks for having me.
Still to come, former National Security